Hello and welcome to a special interview for The Wire. Do we have credible evidence to suggest that, in fact, the present surge of coronavirus has peaked and is starting to plateau? Or is that a hasty and misleading conclusion that could lead us into a faulty analysis of the situation we face? That's the key question I shall raise today, and my guest is someone who is uniquely placed to answer that question. She's professor of epidemiology, biostatistics, and global public health at Michigan University, and one of the most welcome guests on this program, Bhramar Mukherjee. Professor Mukherjee, before I talk to you about how you see the next 4-6 weeks, let's start with the situation facing the country today. As of this morning, Saturday, the 15th of May, coronavirus has increased by just over 325,000 cases. Deaths have increased by just under 4,000 cases. But the government, both at their press conference today, Saturday the 15th, as well as 2 days earlier on the 13th, point out that in 20 states, the situation is plateauing, and the evidence they seem to offer is that in 316 districts, the trend in cases may be rising, but in 338, the trend is declining. So how do you respond to this view that although cases and deaths are still increasing by a worryingly large number, overall, the situation is plateauing?
Thank you, Karan, for that question. So we are all thinking about the situation and monitoring the situation in India at a granular level, and I'm glad that the government is also doing so. So let me divide the question into actually 4 parts. So the first part is that whether the peak has been attained at a national level. So last time we talked, actually, most models that I know of predicted the peak around this time, around mid-May. So I do believe that there has been a slowdown of the astronomic growth that we saw in April. So the second part, do I believe that the reported numbers that are representing the height of the peak is accurate? The answer is an emphatic no. The third point is that when we are looking at India, India is really a nation, multiple nations within a nation. So I'm still concerned about many states, Tamil Nadu, Karnataka, West Bengal, among the large states, a cluster emerging in the Northeast. So I think that let us not declare premature victory yet another time. I'll really err on the side of caution. So we do believe that in some parts, and India's curve is actually determined by the large states. We already know that. And the shelter at home effects are kicking in. The fourth point, if you get yourself used to a very huge number, like 415,000 cases and 4,000 deaths every day, even 300,000 cases and 3,500 deaths seem small to you on a relative scale. But these are astoundingly large numbers, the largest daily reported numbers any nation has reported in the world so far. So it's still a national catastrophe and a self-inflicted one, as the scathing editorial in The Lancet said. I care about these numbers. Sorry,
please carry on. Please carry on. I interrupted.
And I actually really think about these numbers as real people and real faces. And this is an astronomical cost, humanitarian cost to the society.
Can I pick up on the second point you made? You said, do I believe the numbers at the height of the peak? And the answer is an emphatic no. Are you saying that, in fact, the actual number of cases is far greater than the officially detected ones? And if we only focus on the officially detected cases, which incidentally is an increase of 326,000 as of yesterday night, then we're misleading ourselves into believing it's lower than the reality. Is that the point you're making?
Absolutely, that the relative growth rate has slowed down, but the absolute numbers are still very high. With limited testing, we really do not know these numbers. And so there is no room for complacency here.
But you do accept that the relative growth rate has slowed down. We're still growing, but we're not growing as fast as we were a week or 10 days ago.
Exactly. And I think that all the models did predict that this is going to happen in mid-May.
And does that therefore suggest that we've touched our peak and begun plateauing? Maybe not declining, but plateauing.
I would say so. I would say so.
Let me then at this point raise with you two areas where the government and public opinion sees cheerful news, and one where in fact we simply don't know, but we're very worried about the situation. The first of the two cheerful areas is Maharashtra. Maharashtra yesterday grew by under 40,000, which is a lot less than the 70,000 levels it had reached in April. Bombay grew at under 2,000. The positivity rate in Maharashtra, the state, is just over 17%. In Bombay, it's just over 6%. Do you get the feeling that Maharashtra and Bombay, perhaps in particular, is declining? And this is a good news story?
Yes, yes, I definitely think so. And I tweeted about it maybe a week ago. And I think that it's astounding progress. And the R value, the growth, one of the measures of growth, has declined from 1.7 in March to 0.8, around 0.8 now. The test positivity rate is also come down from 24% to 17%. They're doing a large number of tests. So we do have belief in this data. Maharashtra is doing about 250,000 tests every day. Still 800 deaths about are happening. And so we have to be really mindful of what we do as an exit strategy as we come out of the shelter at home orders. I do expect our models are predicting by the end of May, we are going to see, as you said, 40,000, but it will even come down further to 10 to 15,000 cases. So that's extremely good news.
So Maharashtra will be down to 10, 15,000 cases in about 2 weeks' time. That's the end of May.
That's what the models are predicting. So sometimes I bear good news also on your show.
What about the other area where people in India believe we are seeing clear signs of good news? I'm talking of the capital, Delhi. You may recall that roughly a month ago, Delhi was increasing by 28,000 a day. The positivity had reached an astonishing 36%. Today, just before we began this recording, the Chief Minister has announced that yesterday Delhi increased by under 7,000 and the positivity has fallen to 11%. Is Delhi becoming a second good news story?
So I do believe that Delhi is less clear because they're doing 80,000 tests a day. It's relatively little compared to the population of Delhi. But I have been watching these numbers like a hawk every day. So even after controlling for the testing effect, I feel that there has been a genuine decline. And we have to be mindful that, deaths are a lagged indicator. And our models are predicting that Delhi will come down to about 1,000 cases by the end of May. So again, I hope these are good news and these actually turn out to be true.
Let me then at this point put you the one area which we don't know very much about and which is becoming an area of concern, and I'm talking about rural India.
Yes.
The anecdotal reports, whether it's of people ill, whether it's of burials, whether it's of bodies floating down the Ganges, all suggest that coronavirus has spread. And the only confirmation from the government is the following. Both today at the press conference and on the 13th, they've said that 516 out of 734 districts have positivity rates above 10%. That's 70% of the districts of the country. Doesn't that suggest that it has spread in rural India fairly widely? And the anecdotes that we're hearing about burials, cremations, bodies floating, people being ill, all of that add up to this picture. It is now a major problem in rural India.
I do believe so. And personally, I really feel appalled by the quality of data and reporting, both in terms of infections and deaths in India. Rural India is a big mystery, and really accurate reporting, even if not tests, syndromic surveillance, wastewater testing, we could actually get some credible data from rural India, even if we do not have testing capabilities as much as the big metros. So it is very hard to say what is going on, and good models need good data. But I do think that data transparency and more nuanced information, even if we do not have RT-PCR tests everywhere, is very much needed.
So you're clearly saying there's a lot more that we could do to find out the truth in rural India, and we're not doing it.
Absolutely.
In which
Absolutely.
case, let me raise with you a question that was raised by Shahid Jamil in an article he wrote for the New York Times just 2 days ago on Thursday. He was talking about the nationwide situation. He said, and I'm quoting, data show that testing is increasing at a far slower rate than cases. In this scenario, numbers will reach a plateau not because case numbers have stopped rising, but because testing capacity will be tapped out. In other words, he's saying that if we are reaching a plateau, it could be for the wrong reasons. And therefore, this plateau may not be as comforting as the government is trying to suggest.
So I really respect Dr. Jamil's viewpoint, and we presented a very compelling visual graph in an article in the Hindu on May 4th, where we actually plot the rate of growth of cases versus rate of growth of testing in India and compared that to the United States to compare a good testing strategy. And of course, India is not testing enough given the amount of infection it has. But I still do believe that the growth of cases in India is slowing down even after controlling for testing effect. And we have run several simulation models to test that. But I am completely with him that we are seeing only a small fraction of even symptomatic serious infection due to lack of testing and due to this darkness of mystery in rural India. So there is no reason for us to feel good right now because that we are still in a very deep crisis.
But if I can pluck out the silver lining in that answer, you do accept that the plateauing we're seeing is real plateauing because cases are slowing down. It's not plateauing because we've reached the capacity of our testing and testing is not sufficient.
I do believe so, yes. And in many places, and
sorry, carry on.
Yeah, I think I want to make that statement nationally. I think so. In many places, there is like extremely limited testing. So it's very hard to say what is going on. Data from certain states look really surprising to me that how fast they have fallen. And I'm skeptical about some of those data quality.
Let me at this point put one more question to you about the situation that prevails today. According to the latest weekly report put out by the World Health Organization, which went out, in fact, on Tuesday, the 11th, just 5 days ago, India refuses to classify itself as a country with community transmission. The report clearly shows that India insists upon classifying itself under the lower and lesser serious classification called cluster of cases. Now, my question is simple. For the last 25 days, India has been growing faster than any other country in the world. Secondly, as the government confirmed this afternoon, the nationwide positivity rate is 19%. And thirdly, as the government said again this afternoon and 2 days earlier, 24 states have positivity above 15%. Apparently, 10 states have positivity above 25%. In those circumstances, as an epidemiologist, can we really say there is no community transmission in India?
I prefer to respond to serious questions, Karan. Is this a joke? I come back to your show as a scientist and defend my science, defend my predictions, and justify it why I think so. Let us go back to Epidemiology 101 and the fundamental definition of community transmission. I really urge and welcome the officials to contact trace and identify the source of even 10% of India's, let's say 5% of India's millions of infections. There's absolutely no semblance of science in this claim.
That's really strong. There is no semblance of science in this claim that we're not in community transmission. And as you said, or as you asked, is this a joke?
Absolutely.
Then let me put this to you. Experts outside India will be aware that India refuses to accept there's community transmission. And all those experts like you have access to the truth. They follow India closely. There's nothing about the pandemic in India that they don't know about. So when they repeatedly hear the Indian government say, this is not community transmission, what impact does it have on experts like yourself and many others in America and England?
We do not have to go to America and England. I do think that Indian scientists in India and card-carrying epidemiologists and experts also disagree with this statement. And so they should speak, not the expertise should count, and the statements made by government should really be guided by epidemiology, data science, and viral transmission by experts. So you don't have to go outside India. I think scientists in India recognize that this is not guided by science.
Absolutely. And as you said, scientists in India should speak out and make it clear they don't accept this. Hopefully, they will. Let's, at this point, Professor Mukherjee, turn to how you see the next 4 to 6 weeks. Your university, and you in particular, do some of the best mathematical modeling of India's COVID trajectory. When I interviewed you last on April the 22nd, you said you believed your projection showed that India would reach its peak in terms of infections in mid-May and in terms of deaths at the end of May. Am I right in concluding from your earlier answers that those projections and those dates are more or less coming true? We're plateauing, which suggests we've reached the peak of infections, and we're probably going to reach the peak of deaths 2 weeks from now. So do you believe your projections have been validated?
So, of course, in terms of total number of infections, it is a moving target because the more you test, the more you find. But unfortunately, the projections for death, where we said that around 4,500 deaths a day at the peak, have come true. And I did not want that to come true. And I am sad to see that come true. I also had said that April is the cruelest month and where we are going to see this severe surge. So I also want to say that the deaths being a lagged variable, this has somewhat have been untrue for India recently, because I think there is a delay in testing, and then there is a healthcare capacity bottleneck. So the time from diagnosis to death have really been shorter. So you see that the cases and deaths peaking not in a like what you did expect, but at the same time almost.
Now, you're absolutely right when you say that in terms of your model's predictions about deaths, you've come true. You had said there would be 4,500 by the end of May. There have been days, a couple of days ago, when we were touching 4,200, 4,300. So on deaths, you're right. But in terms of infections, you said to me that we would peak mid-May, somewhere between 800,000 and 1 million. At the moment, the highest we reached 4 or 5 days ago was 414,000. Is that because the model was wrong in terms of the quantum of infections? Or is that because, as you said earlier, you don't believe the figure put out about infections?
So a couple of things is that I'm very happy to be wrong. I never wanted to be right in this case. So this is one of those cases where I'm delighted to be wrong, because if human beings through their actions and policymakers can beat the dire model projections, that's where the success of a modeler is, that people took you seriously and intervened. So I do think that our projections were under no interventions or the mild interventions that were going on in the country. Since then, there have been several stay-at-home orders. Elections are over. West Bengal, Tamil Nadu, Karnataka have all entered into a semi-lockdown or full lockdown mode. So of course, it is also a function of testing. But there is really the number of reported cases tell you the tip of the iceberg. There is a lot more infections and even serious infections that we are failing to count and report for. I do believe that. But again, my summary is that I'm happy to be wrong on that account.
Let's move on. There are some people who say, looking down the road, that just as cases shot up like a rocket in April, they'll come cascading down equally sharply. There are others who say, no, it's probably likely that they will meander down slowly, that we will plateau at a very high level for several weeks, and the tail will be quite a long one. Which of the two views do you go with? A cascading down or a plateauing and a long tail meandering down slowly?
Yes, so you put that beautifully, and I'll put it in terms of numbers. Is that what we see in our models? Is that I do see sort of there is a, if you look at these curves, they're almost always sort of a symmetry, right? If you look at the first peak, also there is a symmetry from the peak. So we do see that the cases are coming down at a reasonably decent rate. So we see in 2 weeks about the 320,000 is coming down to 150,000 to 200,000, so 1.5 to 2 lakhs. But this is still high. But we do see about 3,000 deaths each day, even in 2 weeks. So I see a slower rate of decline in deaths. And if you think about it, if you compare to where we were in February, right, when we started seeing the uptake, that will still take a while. So I think hospitals, his systems will still have a large burden in the month of May and June.
I'm just repeating what you said because I think it's very important. People should understand that you believe in 2 weeks, the increase in daily cases will come down to somewhere between 150,000 and 200,000 a day. At the moment, it's just over 325. So it'll be quite a sharp decline, even though 150,000, 200,000 a day is still a lot of daily cases. And deaths, you believe, in 2 weeks will come down more slowly to around 3,000 deaths a day. Have I summed that up correctly? Have I got it right?
Absolutely.
But
as always.
But you added that it will take a longer while, a much longer while, to get back to the position we were in February. I take it what you're saying is that the actual petering out of this surge will take a lot longer than 2 weeks. When do you think that petering out will happen?
So, even if we try to normalize these large numbers because we are getting used to large numbers every day, I think that it's still like we are looking at about 100,000 more deaths in the next 1 month. That's the key quantity that I want to focus on. I do expect by mid-June we'll see some distinct improvement, but we have to be really cautious because we are going to be lifting the lockdowns. And if we do not adopt a optimized, nuanced, and strategic exit plan, then I think that it would be hard for us. We really need that to maintain this declining trend. And then we also have to be set up to curb outbreaks if we see in the foreseeable future. So it's conditional on a lot of ifs. But I do expect that by mid-June, we'll have a sense of improvement. But the whole summer, we'll have to deal with this pandemic.
So you're saying that over the next month, you see another 100,000 deaths.
Yes.
In other words, another lakh of deaths over the next month. But am I right in interpreting you to say that by mid-June, that's roughly a month from now, we'll see improvement? Does that mean the surge will have petered out by mid-June?
So, you have to define, what do you mean, like quantitatively, where it has phased out. So as what I'm saying is that I think May and June are still going to be full hospitals. And then, but you are in the numbers, I think you'll see a distinct improvement by mid-June. And then in July and August, we can expect, if everything goes as planned, and again, a lot depends on how we come out of these lockdowns, then we are going to be in a similar position that we were when the second surge started. That's the definition of petering out.
Quite right. So we have to wait till July and August to go back to the position we were in February before the surge started. In other words, the surge won't peter out till July, August. And as you said, May and June, we will still be seeing full hospitals. That means people will still be falling ill and needing hospitalization, ICU, oxygen, perhaps ventilators. That will continue.
Yes.
One more question, because this tantalizes people. Do you have any sense of what will be the total number of official counted cases and official counted deaths when we reach July, August?
As you know, that I have written much about it, that I'm very skeptical about the official counted cases and deaths. And if I have to predict that, so I think that, I don't want to stretch beyond 4 to 6 weeks, because I'm skeptical about these models, and the reality on the ground and the interventions change shows so rapidly. So I think that by mid-June, as I said, in the next 1 month, we are going to have another 100,000 deaths. That's our sort of models are telling right now. So then we'll get to 360, 370,000 total deaths by mid-June. And by that time, we are going to report, our models say, about 30 to 32 million cases. So, but then there will be July, then there will be August. So we'll probably be number one in the world.
A dubious distinction indeed. My last question, and you know this from your knowledge of India, that absolutely no one in this country believes either the daily death count or the total death count. And you only have to look at the evidence from crematoria, graveyards, and obituaries in the newspapers to understand why. In interviews that you've done both with me and with other people, you've said that India undercounts deaths by a factor of somewhere between 2 and 5. Do you have a clearer idea of that undercounting, or is it still within that range?
So I think that, the estimates that I provided are from wave 1. In wave 2, we are hearing much more stories, particularly from rural India, where we do not have a good reporting system in general. So I believe that I'm siding more towards the higher end of that interval. And I'll give you a quantitative estimate, and then I'll also make a qualitative statement. So I believe that it's 4 to 5 times than the total number of deaths. So we are reporting about 260,000 deaths, total deaths right now. But I do believe that more than 1 million people, 1 million to 1.25 million deaths attributed to the COVID-19 has happened. And there is tremendous variation in terms of this underreporting across geography of India. But there is a way we could validate these numbers. So I really strongly urge, beg, and request the Indian government to release disaggregated data across age and sex and and on COVID cases, hospitalizations, and fatalities, as well as all-cause mortality data from 2020 and 2021 so far, so that we can see, given historical trends of mortality in India, how many excess deaths have happened. So you don't have to rely on folklores put out by modelists and statisticians. And then the last thing I want to say is that this pandemic has left the lives of very few of us unaffected.
That is absolutely true.
And that does not total up to 260,000 deaths. That experience.
It's much, much more. And what you're saying, but you said it politely, not so bluntly, is it's time the Indian government started telling the truth to the Indian people. Whether it's about accepting the fact that we clearly have community transmission and it's a joke to try and deny it, or whether it's accepting that the number of deaths is much greater. And we cannot continue with stories from Gujarat, the Prime Minister's own home state, where increasingly you get proof that deaths, even of people who tested COVID positive, are not being counted as COVID deaths, but being attributed to comorbidities. That again is fooling the Indian people, and it's time this stopped.
So I always say that truth is better than fiction, and also data transparency is really key to managing this pandemic. And it's really, the models are used to predict healthcare utilization, healthcare oxygen needs. So it can really save lives if we have good data and if we have a good grip on the pulse of this pandemic. The IHME model is predicting like 1.25 million deaths in India by the summer, and many, many more infections. But I really think that there is a way to address this by setting up a data ecosystem And this is an investment India needs. It's a moral investment and it's an infrastructure investment that would really safeguard us against future health crisis.
Thank you very much indeed, Professor Mukherjee. I hope the government is listening, and more importantly, I hope they heed your advice. Thank you. Take care. Stay safe.
Thank you.